These are some of my reflections from the Hepner, Keegan, and Coelho articles. I do have the questions and some of my notes written down here, so I'll be looking down occasionally. So, number one says to describe an idea from the reading that changed or expanded my understanding of TBI and why this specific idea stood out to me. So, I have here a quote that talks about how non contrast CT scans are commonly used as the first measure of brain pathology and trauma, and that CT scans are really good at identifying skull fractures, hemorrhages, or hydrocephalus. However, they fail to detect some of the other pathologies that might take time to elapse. And this was particularly interesting to me because it ties into the central idea, or the ongoing idea, that TBI symptomology often takes place several months after the initial TBI. And I think that makes a lot of sense because you go in and you get your brain scanned, and if whatever is wrong with you is not localized to any specific area of the brain yet, or not popping up yet, it makes sense as to why they're like, okay, you must be fine, or everything's okay, and then they come back and they deal with all of these and they have all of these complaints and symptomology. I think before I kind of just didn't have an idea as to why. I knew why, or I knew that sometimes that was the case in TBI survivors. However, I think I didn't necessarily know why, so this specific quote kind of helped clear that up for me. Number two says, how do the discourse challenges described by Coelho relate to the healthcare experiences reported by Hepner and Keegan? Provide at least one specific connection between the communication difficulties and their quality of life. So Hebner and Keegan speak a lot about the lack of continuity of care in TBI patients, and what a lot of professionals who are not adequately trained in cultural competence fail to realize is that different social determinants of health, such as education or literacy, will directly affect a person's health outcomes. So, for example, if an individual with a TBI with a high school education comes in and they're trying to explain themselves to a healthcare professional, but if they struggle with articulation, and some more of those are those hallmark features of discourse, such as coherence, cohesion, storytelling, topic maintenance. How can they be expected to adequately articulate their symptoms to a doctor, right? Those chances might be little to none. And I also think that, kind of tying along with this, the aspect of their social communication, might be the fact that they get frustrated, right? So they might get frustrated if they can't express themselves, or they might just be angry in general that they're going through this, but they have like little to no support. And so that ultimately will affect their temperament, which is like obviously a big part of pragmatic communication. And so they have a higher chance of being written off as like crazy or rude when they just are trying to express themselves. And I think that just kind of directly ties into the third question that talks about, as a future SLP, what would I do differently to mitigate this issue of TBI patients having, well, it says, as a future speech language pathologist, what is one thing that you would do differently when working with a person with TBI based on these readings? So, I always think that about my goal as a future SLP is just to meet my patients where they are and practice cultural competence in any way. And I understand that in an acute care setting, like, what happens after they leave my care is maybe not entirely up to me, or not entirely something that I can control. But while they are with me, I can commit to being present. I could commit to not being biased in my treatment. I could commit to being very compassionate and person-centered in my treatment with these individuals, because I think that that's where the lack of continuity of care is kind of coming in, is that like maybe they feel like they're written off in a hospital, and they feel like, well, it doesn't really matter because they wrote me off anyway, why am I going back? Or they don't have like the adequate resources or social or different levels of social determinants of health to keep them from coming back. And I just think that if I show up as like open-minded, compassionate, and meeting them where they are. So like if they don't have more than a high school education, I shouldn't be doing any intervention that's overly challenging. I guess in general you shouldn't be doing that because of their cognitive level, but just, yeah, meeting them where they're at, being super aware, and always being culturally competent. What aspects of the reading was most surprising, concerning, or meaningful to you? So this excerpt I think also comes from the Hebner and Keegan article, and it talks about how TBI individuals report a complete loss of self, including a loss of clear self-knowledge, a loss of self by comparison, and a loss of self through the eyes of others. And they must like renegotiate their sense of self, but it's compromised by ongoing cognitive, physical, relational, and emotional regulation impairments. And so I think this particularly was surprising, concerning, and meaningful to me, because this kind of sort of juxtaposes what we learned about a patient's sense of self in aphasia. Yes, like the underlining idea is that they lose this sense of self, or they like have this lack of self-identity, is still there. But I think it's different because we talk about in aphasia, cognition remains intact, intellect remains intact. And so like they have this loss of self because they can't like express it, and they feel like they're trapped in their own head, but the intellect is still there. Whereas like these people, that must be entirely devastating, entirely different end of the spectrum, to have this sense of self, to have a loss of sense of self, and then not even have the memory to like jog it back. And so it's like, okay, I thought about like, so if you don't have like a good support system or adequate therapy, how are you ever going to be able to come back to your true sense of self, right? You're not. And I think like just that central idea that these individuals in both of these courses, we're talking about individuals that might be dealing with a similar thing, but just two completely different ends of the spectrum. Because like a person with aphasia, they might be able to kind of return back to that person through intensive therapy, through getting the language back. Whereas a person with a TBI, if they like have loss of memory, if they have just an extreme loss of cognition, those chances might be slim to none. So yeah, those are some of my reflections. I hope you enjoyed listening, and thank you.